welcome back to our podcast. This is Tada Kenya podcast, and I'm your host, Maureen Salim. And today we'll be discussing about suicide and suicide prevention since we are celebrating Suicide Prevention Awareness Month. And before we get into the discussions, I'll let my guests introduce themselves, starting from my left.
Thank you. My name is Faith Maina. I'm a psychiatrist, clinical officer.
My name is Raphael Wambura, also a psychiatrist, clinical officer.
And before we get into the discussion, and this is just to give you an awareness of how suicide is really claiming a lot of lives out here. And according to WHO, they record around 700,000 deaths yearly. And this means we are losing lives every 40 seconds. So that is something that is really alarming, and today we are just here to enlighten you and just to create awareness on suicide prevention. And before we get deep into the discussion, kindly just explain to us what suicide is.
Yes, suicide is a situation where somebody takes away their own life, usually as a result of underlying mental health problems, though sometimes it can also be impulsive.
So to faith, right?
Yes.
Yeah, so what are some of the causes that may push someone to take their lives?
Some of the causes are associated with mental disorders, in particular depression and alcohol use disorders, and also other substances of abuse. At times, suicide can be impulsive, like my colleague has mentioned. In moments of crisis, that is where one breaks down due to the inability to deal with life stresses, and such instances are financial problems, relationship disputes, and chronic pain and illnesses. Yes.
Oh, it's that bad. Relationship disputes. Okay. I'm seeing my cameraman a bit short. So yeah, relationship dispute is among those things that may trigger someone to want to commit suicide. So you've mentioned mental health is somehow related to suicide. So can you bring out can you help us bring out the relationship between those two? Because to most people, they may not know the difference between mental illness and how it contributes to someone wanting to kill themselves or commit suicide.
Yes, thank you, Maureen, for that question. In fact, people do not understand the difference between mental health and mental illness. So what we are saying here is that mental illnesses can lead one to into suicide, but we all need mental health. Mental health is just a state of well-being in which an individual is able to cope with the daily stresses of life and work productively and contribute to their society. So when one is not able to cope with daily stresses of life, then it becomes a problem. Now it's a form of a mental disorder or mental illness. Yes.
So suicide is not an illness. It's something caused from a mental illness.
Yes, it comes as a result of, as part of other mental illnesses, usually depression, as my colleague said earlier.
So it's not an illness, but there are these signs that we can always say they may contribute to suicide. What are some of these signs, Faith?
Well, there are many. There are a number of signs that can be manifested in someone who wants to take their life, and some of them is being taking too much time in thinking about and talking about death or dying. So yeah, they take a lot of time to talk about death and most of the time their thoughts are occupied by dying. So even when you talk to them or when they are among other people, they will be talking about death most of the time or about dying. And so they are preoccupied by that thought, and most of the time they keep finding out, researching about how people can die, one can die. Yeah. The other sign is that they may be having extremely low moods for over a period of time, and yeah, meaning that they are sad most of the time. Yes.
Oh, so there are people out there who just think about ways of how to die.
Yes.
That's really surprising. That's really surprising. So, just like any other measure that can be put through, what are some of these measures that can be put through to help these people?
I just wanted to add, sometimes also you'll find that these people who are likely to harm themselves, they will be isolating themselves. There will be some change in their behavior that is not how you knew them to be before. And sometimes if they have even some valuables, they will give away these valuables because they are preparing to exit. So they will hand over whatever valuables they have. If they are children, pets, they will be giving them away. So we should be very concerned when somebody gives their valuable things to us. We should ask them, why are they doing that?
So, for example, I have a cat. So if I give you my cat, then people should be worried out there.
Yes, even as you don't just take it and keep quiet. You should ask, what is the intention? Probably you could.
Maybe I want to gift you that cat,
Yes.
and I'm like, Daktari, have my cat. He's my best friend, but you can have him for now.
Yes, maybe giving me that explanation will help you maybe.
So I won't explain, I just
Yes.
give you like a surprise.
So I should also seek an explanation from you. Why are you doing this? And it will let me understand. Are you becoming suicidal or you're just generous?
Though it doesn't come as a single indicator,
Yes.
it is associated to other indicators.
Yes.
Yeah, I can also add that another sign is that people change their behavior. Like they have been extremely very low, quiet, but now they are all of a sudden very happy and outgoing. So that one should raise an eyebrow, and people should get concerned about that. Again, people have risky behaviors, taking risks because they are not worried of dying. So risky behavior like drunk driving, very fast driving, that is careless driving. Yeah.
So back to the measures. What are some of the measures that can be put to ensure that we save more lives?
Yes, measures that can be put could be geared towards like creating more awareness about suicide the way you are currently doing, and also limiting access to means of suicide. Like, for example, we have a lot of suicides completed through agrochemical products. So maybe if some policies are in place such that somebody goes to an agrovet to buy some of these agrochemical products, they are asked, what are you going to do with this?
Back to you, Faith. What are some of the measures? Just to add on what Dr. said.
Yes, another measure is creating awareness like we are doing now, giving that information to people so that they are on the lookout and they are more aware about their lives and their mental well-being, so that when you give information, you give the signs, the preventive measures. So now they are more aware of the signs and they can observe that either to themselves or even from their friends. And when they observe that, then they can take measures to prevent suicide.
So we are in the 21st century and information is all over. Do you guys think that our creation of awareness has been done like 100%? And if it's not 100%, Hey, do you think that awareness has been created, considering the fact that we have a lot of sources that give information? Sorry.
Yes, we can say there's some effort that has been put into place, but there's still a lot that needs to be done, even among the health workers, so that they are able to pick these signs and symptoms of somebody who is suicidal.
Mm-hmm.
Because research also shows that people who are suicidal sometimes they have a recent clinical visit and the symptoms were not picked by the healthcare workers.
Just to interrupt that you said you still believe there are a lot of gaps that need to be covered. So what are some of the gaps that you really want the government of Kenya or maybe the county government of Kisumu to fill those gaps?
Like improving access to mental health services. Like currently you will only find them at maybe the urban settings, like for Kisumu, maybe Kisumu Central, maybe somebody in Nyakach, or maybe in Muhoroni, maybe they have limited access. But now if we extend these services to those areas, or even do on-job trainings to help healthcare workers so that they are able to pick the signs and symptoms of mental health conditions. Like now the government has launched a guideline for treatment of common mental disorders. So if it is disseminated as wide as possible, it will help healthcare workers to manage mental health conditions and also identify suicidal behavior early. Yes.
Back to you, Faith.
Yes, thank you, Maureen. I think accessibility of the services, and also the government has a role of employing human resource so that this accessibility is achieved, because the services could be provided, but there is no provider, or the provider is there but with a lot of workload. So the government has a role of creating more employment and deploying more human resource, to provide the services.
So as we conclude this episode, I want us to paint a picture of the world we want to see when it comes to suicide prevention awareness, or just suicide prevention. The world we want to see in the next maybe 3 years, 4 years, or maybe 10 years.
Yes, I would want us to be in a world that suicide is not stigmatized, such that when one mentions suicide, antennas do not straighten up, because it is such a big word. We want it to be something normal, just like malaria, such that when one mentions that, then they know the mention of suicide means that some action needs to be taken. So where people can freely talk about suicide, and they can now easily recognize that one is in a crisis and they may be heading to suicide, and they are able to prevent loss of life through suicide.
I would also want maybe during that period a world where we are more aware of our mental health concerns are given the weight they deserve, because that's where suicide prevention falls. So the same breath we take into taking care of physical health, we should also use the same for mental health.
This episode, that is all from us. Just keep the conversations going. Don't forget to share, comment, and subscribe. And if you have any burning question, just keep it under the comment section, and we'll get back to you and we'll address all the questions you have. Bye.